So here we're going to go through some terminology that's important um, in the field of anatomy and physiology, and you're also going to find that this type of terminology, if you are planning to go into any sort of healthcare field, is very useful and um, and helpful. And this is information that you would use every day in your practice. So it is important for us. Anatomy has to do a lot with positions of structures to other structures because our body is so dimensional. So it is important to have kind of a language in order to convey that with others. So the first thing that we're going to talk about here is called anatomical position. And this is how we always reference our patient or our cadaver as if they were in anatomical position, even if they aren't. And so anatomical position is basically the person is standing and their feet are slightly apart and their arms are by their side and their palms are facing forward. Okay, so even if your patient or the cadaver in the cadaver lab is lying on their stomach with their arms twisted and their palms facing backwards instead of forwards, we always reference structures as if they were in this position, in anatomical position. We also have some regional terms to talk about. So we can take the skeleton as a whole and we can divide it up into two different regions. So the first one is going to be the axial skeleton, and that's shown here in this image as kind of the blue part of the skeleton. So we've got the skull, we've got the spine, and then we've got the rib cage. Okay, so the head, neck, and trunk would all be considered axial skeleton. And then the rest of the skeleton, the other part, is going to be considered the appendicular skeleton. And we say this because the appendages are what we call our arms and our legs. And so our shoulder girdle, which is our shoulder blade, and then our upper extremities, and then our pelvic girdle, which is like your hip, kind of what you think of as your hips or your pelvis, and your lower extremities are all going to be appendages, and they are classified as your appendicular skeleton. Okay, we have some different regional terms that we can talk about. So we can break up areas of the body to talk about different regions. So for example, cervical. So here's cervical, and cervical means the neck. So it can mean the posterior neck, which is what you're seeing here in the back of the neck. It can also mean the front of the neck. So it's related to the neck. There are a couple, you do need to go through these. A lot of these are going to be terms that you're familiar with, like orbital means eye, nasal means nose, that sort of thing. Some of them you may not be familiar with, and you may just have to go through it. But a couple that we need to talk about here. So we have this one, which is crural, and that means the front of the leg, kind of like your shin bone. And then sural is going to be your calf on the back part of your leg. And so those are specific there. But go through those and take a look at the regional terms and kind of pair them with that area on your body to help you practice that. We also have what are called directional terms. And directional terms allow us to describe or relate one body structure in relation to another. So we can say, well, our nose is in this position between our eyes, for example. So we would obviously use more technical words for that, but this allows us to use medical terminology and to be very precise about structures that we're talking about or structures that we have treated or done surgery on, that sort of thing. So it is really important. I mean, we see, more than we really would like to see medical malpractice situations where, either it wasn't documented correctly in the chart or thoroughly in the chart, or someone went in for surgery and got their left and right mixed up and we didn't have a check coming along behind them. So certainly documenting very precise structural relationships to one another is very, very important. So here are some example of directional terms. And again, these are terms that you do need to be familiar with and be able to use. And we will use this throughout anatomy and physiology. So we'll talk about structures being superficial to another structure. And it's, after this, we'll be assumed that you know what superficial means, and so that you can kind of picture that in your head. But we've got a few here: superior, inferior, anterior, posterior, meaning front and back. And we've got a couple different terms there that are synonymous for that. Medial would be closer to midline. If you dropped a line down the center of the body, lateral would be further away from midline. Intermediate would be a structure that's in between. For example, the nose is intermediate to the two eyes because our nose is in between the two eyes. I do want to talk about, let's see, this one, proximal and distal. So proximal and distal, if you'll look here, we're using proximal and distal on appendages. So these are primarily used for the appendicular skeleton. And we reference proximal and distal, two structures that are, so like for the arm, it's where the arm attaches to the body. Okay, that would be proximal. And anything further away from that would be distal. So for example, proximal means that it's closer to that point of attachment. So let's say the shoulder is proximal to the elbow, right? The shoulder is closer to the point of attachment of the arm to the body than the elbow is. For distal, it's going to be further away from that point of attachment of the shoulder or the hip to the body. So for distal, let's use a lower extremity one. Let's say the foot is distal to the knee because the foot is farther away from where the leg attaches to the body. Excuse me. And so the foot would be distal to the knee. But proximal and distal, we tend to see much more with appendicular skeleton. So my advice is to only use that with appendicular skeleton. Superficial and deep is basically related to like depth. Like superficial would be more towards the surface or the outside of the body. Deep would be deeper structures. And then we're going to have, I do want to point out, superior, inferior are going to be directional terms that are related more to the axial skeleton. So, for example, the head is superior to the trunk, which would be like the main part of your body. So superior and inferior used for axial, proximal, distal used for appendicular skeleton. So make sure you go through those. We also have body planes. And so this is basically like slices that we can cut the body in, or we can cut a particular structure of the body, and so we can open it up and see structures on the inside. And so what we see here are three types of planes. One is sagittal plane. So sagittal plane is going to cut through, if you look here, it's going to cut our body into left and right parts. So it's basically a cut through the center or through the body, resulting in a left side and a right side. Now, there's some cases where it's going to divide the body equally, and that's what we call a mid-sagittal plane. They're going to be equal, left and right parts. And then there's going to be other sagittal plane cuts where it's called parasagittal. It means that it's off midline, and they are not equal left and right halves. So it just depends on what type of plane you're looking at. The next one is frontal plane. And what we see with frontal plane is here. So we've basically taken a cut through the person that is going to result in a front half or an anterior and a posterior section of that person. So here's our frontal plane. We can also call that the coronal plane, and that divides the body into anterior and posterior parts. And then our last one is transverse plane. And so that's going to be here. And so this is basically taking a cut that is horizontal through the body. And we see this a lot with CT scans. That's the view that CT scans are in. And transverse plane cuts is again going to be a horizontal cut, and it's going to divide the body into superior and inferior parts, or we're dividing that person into a top and bottom. So planes are interesting. You know, if you cut an organ or a structure in different planes, it's going to give you a different type of view of that structure. So you see it a lot with medical imaging. It's very important in that. And then we can talk about body cavities. So this is just an introduction to body cavities, and then as we get into specific organ systems, you're going to see this come about even in more detail. So we can take body cavities as a whole, and we can divide them into a dorsal body cavity and a ventral body cavity. So dorsal, if you recall from our terminology a couple slides ago, dorsal means posterior. So these are going to be body cavities that are located on the back of the body. So posterior, and if you look at this image, this is a sagittal plane view of the person. We're looking at them from the side, and you can see here in yellow we've got the dorsal body cavity, which we can divide up into cranial cavity. So now if you think about your regional terms, cranial means skull. So here's our cranial cavity, which is going to include or contain the brain. And then we've got our vertebral cavity that's traveling kind of down in between the spine and between the vertebrae, and that's going to contain the spinal cord. So we can take the dorsal body cavity that's on the back of the body, and we can divide it into the cranial cavity and the vertebral cavity. Now we can also take the body and divide it into a ventral body cavity. And ventral is going to mean anterior. So we can take the anterior body cavity and divide that even further into thoracic cavity and abdominopelvic cavity. So this is what that looks like here. Here in red is going to be our anterior or ventral body cavity. Here's our thoracic cavity, which is going to contain the heart and lungs. And we can actually take that thoracic cavity, so here, and we can further divide it into pleural cavities, which if you hear the term pleural, it means lung. And then we also have the pericardial cavity in the middle, which is for the heart. Okay, so this whole region in between here is called the mediastinum, and that's not technically a cavity. It's just a region within the thoracic cavity, but the thoracic cavity can be further divided into pleural cavity and pericardial cavity. And then if you look down here, we've got abdominopelvic cavity, which can be divided into abdominal cavity and pelvic cavity. So a couple different divisions there, and I've given you here all the specific structures or a general idea of the structures that are located within each of those cavities. Okay, so what we see with the ventral body cavities is that those specifically ventral body cavities, and only these ventral body cavities, not the dorsal, only the ventral body cavities, are covered in this double-layered membrane called a serous membrane. So it's basically going to be a membrane with 2 layers, and then it's actually got fluid in between those 2 layers. And that's kind of the hallmark of a serous membrane. So the 2 layers are called the parietal layer and the visceral layer. So of this serous membrane, the parietal membrane is going to be the part of the membrane that lines the cavity itself. So since this is only occurring in the ventral body cavities, our choices are only going to be pleural cavity, pericardial cavity, and abdominopelvic cavity, right? Because it's only the ventral cavities. The second part of the membrane, because again, it's a 2-layered membrane, so we need to have another layer. So the other layer is going to be the visceral membrane. And visceral means organ, okay? So the visceral membrane is going to be the part of the membrane that's actually covering the organ itself. So basically what happens is that we have the structure or the organ that lies within the cavity. So let's look at pleural cavities. So here's our pleural cavity, and we know that anything that says pleura means lungs. So we know that we're talking about the lungs here. And we also know that we have the pleural cavity where the lungs are sitting, right? The lungs are contained there. So lining the cavity where the lungs are, lining that pleural cavity is going to be our parietal pleura, which is specifically the serous membrane that lines the cavity for the lungs. And then against the lung itself is going to be our visceral pleura, because that's going to be right on the organ itself. So the visceral pleura, visceral tells us it's lying right against the organ. Pleura means lung, so now we know we're talking about the lungs. And then we've got this cavity or a space. And it's really kind of what we call a theoretical space because it's actually filled with fluid. This blue part here is going to be a fluid in between that helps to decrease friction as organs kind of move against each other or as the heart beats. It's going to reduce friction in that area. So anytime you see visceral or parietal, it tells you which one it is. It's either going to line the cavity or it's going to cover the organ itself. And then pleura means lung. So now we know we're talking about the lungs. We can do the same thing with the heart. So here we are with the heart, and the heart resides in the pericardial cavity. Cardia, anytime you see the word cardia, it means heart. So we have the same setup here. It's just we can now apply it to the heart. So the visceral pericardium is going to be, visceral means organ, so visceral pericardium is going to be specifically the part of the serous membrane that covers the heart itself. And then the parietal pericardium is going to be the specific part of the serous membrane that lines the pericardial cavity that the heart is sitting in. And so this is a good representation of that here. If we think like this whole structure here is in our pericardial cavity, we've got the visceral pericardium that's lining the heart itself. Here's our parietal pericardium here, and then we've got this space in between that's filled with fluid. That would be our pericardial cavity. So every time the heart beats, like 70 times a minute for your entire life, it's decreasing friction. Okay, a couple different views of that. And then here's our last serous membrane. So we said our third ventral body cavity is the abdominopelvic cavity. Okay, and we have the same setup here. So the visceral peritoneum is going to be the specific name of the serous membrane in the abdominopelvic cavity. Visceral means organ. So we know when we see visceral peritoneum, it's going to be the specific serous membrane that covers the organs in the abdominopelvic cavity. So all of our digestive organs and reproductive organs. And then parietal peritoneum is going to be the specific serous membrane that lines the cavity that those organs reside in. Okay. So if we look at it, we see this. Again, this is a sagittal plane view. We've cut this person into like a left and right part, and we're looking at it from the inside. But basically, this whole area here is going to be our abdominal pelvic cavity. And we can see in blue the parietal peritoneum. I don't want to write over it, but you can see it lines the cavity. So it's kind of outlining the cavity that the organs are in. The visceral peritoneum, because that's the organ itself, is actually going to cover each of the organs individually. Okay. Okay. And then our final thing in terms of anatomical terminology is going to be how we reference structures in the abdominopelvic cavities. And so there's a couple different ways we can do this. Really the simplest thing is the quadrants. And you see this a lot with, in medical situations, in clinics and that sort of thing. So for instance, patient presents to the emergency room with right lower quadrant pain. And so basically what they've done is they take the abdominal pelvic cavity, which is going to be, all through here, and they basically just divide it up into quadrants. So quad means 4, right? So we're going to divide it up into 4 different regions, and then you've got a collection of organs that lie within that region. So we've got a right upper quadrant, a left upper quadrant, a right lower quadrant, and a left lower quadrant, and with specific structures that are going to reside within each one. A little more detailed look at this would be the 9 abdominopelvic regions. And so this is a little more detailed. This is something that really like anatomists would use, probably more than necessarily medical personnel, but it basically takes the same area. We've got the same abdominal pelvic region, and it's going to divide it up into actually 9 areas. So you do need to be familiar with the terminology of all of these. Hypochondriac means under the ribs. So you can kind of see those areas are under the ribs on each side. Epigastric means above the stomach or above the umbilical region. Umbilical region, you can think belly button. Left and right, lumbar region, and then right iliac or inguinal region, left iliac or inguinal region, because this, if you look back on your body regions, this area right here, this kind of fold in your leg, if you bend your hip up, you see that kind of crease that's formed there. That's called the inguinal region. And then hypogastric. Hypo means below, so below the stomach, hypogastric or pubic regions. But there's your 9 abdominal pelvic regions. It gets a little more specific. Certainly be familiar with the terminology, and as we learn these organs and these organ systems, we'll be able to place them in those specific areas.